There's no cure for heart failure, and even a heart transplant is not a cure for heart failure. You remove the heart, transplant the heart, you have a new pump, but now you're on medicines that suppress your immune system, and you're still seeing your doctors a whole lot, and you're still having an awful lot of testing. So you never get to forget that you're a patient, even with a heart transplant. So the medications, no, there are 2 new medications used to treat systolic heart failure or heart failure with reduced ejection fraction, have been shown to have benefit. One of them, the Entresto, which is made by Novartis, has been shown to have both mortality and morbidity, meaning patients are less likely to die and less likely to be in the hospital if they take the drug compared to the standard of care therapy. The other drug, which is ivabradine or Corlenor, made by Amgen or brought over by Amgen, also has a similar endpoint driven mostly by prevention of hospitalizations. So both of them, I think, have important impacts on patient lives. Most patients want to stay out of the hospital, don't want to be dead. So I think that you could say that their endpoints are very good, but it would be a fallacy to say that they cured heart failure or made the patient's heart failure symptoms completely go away. Well, I think there's always medications in the pipeline for these drugs. There's expansive indications. So I know that Novartis is looking to expand the indications for Entresto to beyond systolic heart failure in the chronic setting, and there's new development. There's nothing immediately coming up to market that I'm aware of in the pharmaceutical area. With the advanced heart failure patients, the ventricular assist device area is rapidly developing new technology. Sometimes it's things that aren't immediately obvious to people, like the batteries change so that they're smaller or last longer, which is a big deal to the patient. But there's also a newer pump coming up, smaller pumps. The companies that are developing the ventricular assist devices are working on better battery technology, fully implantable systems, so that right now anybody with a durable ventricular assist device has a power cord, we call it the drive line, that's coming out of their body, and it's attached to batteries. The next arena of development is going to be having everything fully implantable, so there's nothing coming out of the patient, kind of like what we're used to seeing with the current pacemakers and defibrillators. Syncardia makes a total artificial heart. The difference is that when you have a ventricular assist device, it's exactly what it sounds like. It assists the ventricle, meaning that the patient's ventricle stays in, and these are pumps that are sewn into the heart and then circulate blood around the heart to the aorta and potentiate better circulation. The patient's heart stays in. Total artificial heart's actually been on the market for a while, but we don't hear about it a lot because it's only done at a limited number of centers. I think Cedars-Sinai is getting a very big experience with it right now, but there's other centers that are still using it as well, and now there's 2 sizes, like there's a smaller one and a bigger one. That actually involves removing the patient's native heart and sewing in this device. So the patients have no native electrical activity. If you did an EKG on them, you wouldn't see anything. But they do have a pulse because it's a pneumatic, valvular heart, as opposed to the ventricular assist devices, which are more like a water pump that you might have in a fish tank, and the pump spins. It's an electromagnetic pump that spins. And it really generates a continuous flow and not a pulsatile flow. So the patients, if you did an EKG, you can see their native heart rate and electrical activity, but if you feel their pulse, they don't really typically have a very strong pulse. Most of the time you can't feel it at all because the pump is circulating the blood in a continuous manner, more like a continuous whir, like a fish tank.